We have noted that there is clearly a gap in terms of management of our patients. In as much as we have the latest technology, the drugs, we seem to be missing the gap. And the gap we found is that we don't have enough specialists. Currently, we're only about 400 physicians in the country against a population of 51 million. So there's clearly a deficit of over 100%, and we are trying to bridge this gap. And that is why, as an association, we have created a college called Eastern Central Southern Africa College of Physicians. Now, what is the theme behind this? We found that there's clearly a gap in research. We keep talking about Western numbers, but we're not generating enough data and research on where the problem areas are. And one of the gaps we've noted is, one, we need to work in cohesion as all societies in the country. Number two, there's a clear deficit in terms of training and then in terms of management and screening. So this year we are focusing on, instead of encouraging patients to come to hospital when they are sick, how about presenting earlier just for medical checkups? Because when you present initially to the clinic, the nurse will screen and check your blood pressure. You probably came for a flu, but then at the end of the day discover you have diabetes and high blood pressure. And lucky for you, if a specialist is on board, we start you on management so that you don't end up on dialysis, which would have come 10 years earlier. We can actually postpone that because clearly there's a staggering difference in terms of economic expenditure. What does this translate to? Quite a number of our population is spending so much time in the hospitals, and that means we are reducing our productivity of our young population. And then because we have quite a number of the elderly population, that still brings a gap. So we want to be involved in policy change, and that's why we have even invited the governor of Uasin Gishu today so that we can start talking with government and change policy in terms of management.
We have got very few physicians in the country, and that therefore means that, and in fact, most of the physicians are centered around the major cities, which is Nairobi, Mombasa, Eldoret, Kisumu, and so on. So a majority, probably 80% of the 400 physicians we have are in the major cities. So a majority of our population are not getting the services of the physicians. So one of the things Kenya Association of Physicians has done, like several other associations of physicians within the region, called EXACOP, which comprises Kenya, Uganda, Tanzania, Zambia, Zimbabwe, and Malawi. We are training physicians and deliberately training the physicians outside the major cities. Because universities have traditionally been in the major cities. Now, in that regard, and evidence has shown that if you train, the quality of care improves within the training sites. And this is really what we are getting up to.